A very good evening. You're watching Eswatini TV News Bulletin at 8, read to you by myself, Notile Sitole. First up, let's have a look at tonight's headlines. The shortage of medication for people living with epilepsy worries His Royal Highness Prince Banzile. Government, in collaboration with the International Organization for Migration, has launched the Diaspora Engagement Initiative. Clinics for ex-minors which were temporarily closed will resume operations before the end of next month. And now, the news in detail. His Royal Highness Prince Banzile says it is saddening that the current epilepsy treatment gap is over 75% in most low-income countries. Speaking at Eswatini Royal Residence, His Royal Highness said there is a lack of access to medicine and there is high discrimination and stigma associated with epilepsy from grassroots communities to global level.
The 75th World Health Assembly is calling upon action on epilepsy and its synergies with other neurological disorders. This was revealed by His Royal Highness Prince Banzile as the patron of Eswatini Epilepsy Organization and the chairperson of Africa Epilepsy Trust Fund. Delivering his statement, His Royal Highness said he has realized that epilepsy and other neurological disorders are the leading cause of disability and second leading cause of death worldwide and affects over 10 million people in Africa.
I've come to realize that epilepsy and other neurological disorders are the leading cause of disability and second leading cause of death worldwide, and it affects over 10 million people in Africa. The risk of premature death with people living with epilepsy is 3 times higher than the general population. However, it is a treatable condition and can be treated at a very low cost. It came to my attention that financing epilepsy and other neurological conditions is limited. It is saddening that the current treatment gap is over 75% in most low-income countries. There is lack of access to medicines, and there is high discrimination and stigma associated with epilepsy from grassroots communities to global level. If you and me are to leave no one behind, as per Sustainable Development Goal 3 of ensuring healthy lives and promote well-being for all, we need to consider prioritizing epilepsy in the health agenda of African countries and beyond. There is a need for effective intersectoral partnerships and action plans that involve all stakeholders, including people living with epilepsy and other neurological disorders and their families. I therefore urge all governments and all development partners in Africa and the world over to firstly provide the necessary support to World Health Organization and partners in developing the intersectoral global action plan on epilepsy and synergies with other neurological disorders. Secondly, develop national epilepsy plans and national coordination mechanisms in your countries. Please join me and others to change lives of persons with epilepsy and other neurological conditions. And also, join me in making the world a better place for our suffering brothers, sisters, mothers, fathers, and children to live a fulfilling life. They are counting on us for this, and if this does not happen, people with epilepsy and other neurological conditions will continue to suffer and be marginalized.
His Royal Highness assured the commitment of the Eswatini Epilepsy Organization in their action against epilepsy and its synergies with other neurological disorders. On the news, I'm Polile Mazia at Eswatini Royal Residence.
Eswatini government, in partnership with the International Organization for Migration, has launched a diaspora engagement project. The project aims to involve Emaswati in the diaspora in critical nation-building decisions. Eswatini was represented by Eswatini Acting Prime Minister Themba Masuku.
During the meeting, Eswatini Acting Prime Minister Themba Masuku was represented by the Minister of Justice and Constitutional Affairs, Polile Shakantu. Masuku says government looks forward to supporting the engagement of the diaspora and to learn best practices from their experience of other countries in order to create private-public partnerships and plug the critical skills gaps in the government and other sectors. Masuku says this partnership will, however, require critical fundamentals such as the reinforcement of trust, transparency, patriotism, and professionalism at the very outset of the exercise. Masuku says it will also need to address the lack of access to information about policies, legislation on the ground, as well as day-to-day information about opportunities in the country. Masuku says through government's continued effort to implement electronic platforms in all agencies for improved service delivery and the activation of communications offices in all ministries, he hopes that it will build bridges necessary for the project and others that will spring from its seat. United Nations Resident Coordinator Natal Ndongose says the UN is delighted to partner with the government of Eswatini to implement this initiative that will contribute to the social and economic development of this nation. She says there is no doubt that the engagement with an investment in the economic, human, social and cultural capitals of diaspora will contribute to the diversification of Eswatini's economy. Eswatini ambassador to the United States of America, Jablis Okwebu, she uploaded the launch and says it was long awaited. She says ambassadors of the kingdom, they were very eager to work with the diaspora and have already been working with those who were availing themselves to the various embassies. For Eswatini TV News, Fortune Dlangamandla, Mbabane.
The Ministry of Health says despite a decrease in the number of COVID-19 positive cases and deaths, Emaswati should continue to adhere to all COVID-19 regulations. This was said by the ministry's Principal Secretary, Dr. Simon Zwane, in an interview with Eswatini TV.
The decrease in the number of COVID-19 positive cases and deaths have given the impression that COVID-19 second wave was almost over. The Principal Secretary in the Ministry of Health, Dr. Simon Zwane, says they have also seen a decrease in the number of Emaswati that visit health facilities due to COVID-19 related issues. Dr. Zwane elaborates on the cause of this decline.
This wave that we're experiencing is now coming down. And this, I should emphasize that it does not necessarily mean the virus is no longer existent. We still have people, as we speak, who are harboring this virus, and they can actually transmit it to other people. And this can lead actually to another wave if we are not careful. So we want to continue to emphasize to our people that we continue to social distance, we continue to properly use our face masks, and we continue to wash hands and sanitize hands as we have been teaching. It is a challenge to yourself, it is a challenge to myself, it is a challenge to all of us that we continue to practice those, because if we don't, then there is a high probability of experiencing another wave, particularly as we know there is a possibility of opening up the economy because the economy has been constrained for the obvious reasons. As governments continue or consider opening up the economies, there is a high probability of experiencing another wave.
On Wednesday, a report from the Ministry of Health showed that there were 6,341 COVID-19 confirmed cases in the country, while there were 616 deaths. Active cases were 3,717. For Eswatini TV News, Fortune Dlangamandla, Babane.
The Principal Secretary in the Ministry of Labour and Social Security, Thulani Mkhaliphi, says ex-miners clinics which had been temporarily closed, namely the RFM in Manzini and Latikulu Government Hospital, will resume operations next month. Mkhaliphi said this when giving clarity on the closure of these facilities.
The two ex-miners clinics were used to screen ex-miners for diseases like tuberculosis and silicosis. The closure of the clinics followed that in December last year. The funding of these two facilities by the Global Fund came into an end. The Principal Secretary in the Ministry of Labour and Social Security, Thulani Mkhaliphi, says there is no need to panic as government with stakeholders are working around the clock to ensure that these facilities resume operations next month.
We were hoping then that our processes to secure funding were going to be fast, but unfortunately it has not gone as fast as we had anticipated. So we then decided last week to say, let's then maybe temporarily terminate the services with the hope that maybe in 2 weeks' time, then we would have secured, the funding, so that the services can continue. So we are working in this process together with the Ministry of Health and the Mine Workers Associations, which is SNEMA and SWAMIWA.
Speaking on behalf of ex-miners organizations, Vamajele says it is important for the clinics to remain operating as ex-miners need them for checkups.
Also confident that the team that is led by the Ministry of Labour and Social Security will be able to resolve all the operational requirements within a very short period of time and see the clinics operating again. It is important that this clinic does not only offer the medical services, but it also offers access to compensation. So it is a very important clinic and also a very important one to support the TB and silicosis compensation for ex-mine workers.
For the time being, ex-miners who need immediate medical help can contact Sister Dumsile Dlamini on 7605-4563. For Eswatini TV News, Fortune Dlangamandla, Babane.
Dr. Khosi Mthethwa is the first woman in Africa to be elected president of the International Catholic Committee of Nurses and Medical Social Assistants Vatican City. She says she will work hard to fulfill the association's mandate.
The International Catholic Committee of Nurses and Medical Social Assistants is a private Catholic association which came into existence in 1933, and one of its many objectives is to provide health services to the sick globally. Dr. Mthethwa says she was elected president after her efforts were recognized by the association. She says she will work hard to fulfill the association's mandate.
Humbled by the recognition shown to me by all the Catholic nurses globally, and also recognizing that being the first African and from Eswatini to take this position, I'm very much aware that it's a mammoth task, comes with a lot of challenges, particularly at this time within the health sector. But I do believe that with the help of the Lord and the support from all the members of the organization, I will be able to lead the organization and ensure that it achieves all the goals of the organization.
Dr. Mthethwa will hold the position for 4 years. Reporting, I'm Lungelele Makakula in Babane.
The Shiseleni Regional COVID-19 Task Team on Thursday had a meeting for reviewing and strengthening the stipulated measures and policies for curbing the spread of the coronavirus. The Environmental Health Manager at Nhlangano Municipality, Jabulani Seyama, says businesses and all Shiseleni residents should comply with all the health and safety standards against COVID-19.
The Shiseleni Task Team was formed when the COVID-19 pandemic first hit the country last year, and it has been on the ground fostering compliance by disseminating information on good hygiene practices across the region ever since last year to date. The Nhlangano Municipality Environmental Health Manager Jabulani Sayama says over 300 people have been arrested for not complying, including business owners, motor vehicle drivers and people in town. He says on a positive note, however, the numbers of non-compliant people continues to decrease.
Solely we are ensuring compliance when it comes to COVID-19 because we've seen that most business people have got a tendency of not complying, more especially when it comes to issues of cleanliness, food hygiene, together with other issues like health and safety on their trade of premises. Most of the business people, more especially those who come from Asia, they are not complying much. They are selling expired foods, damaged foods, together with their level of cleanliness. Actually, it's totally poor. So we're ensuring that such things are being corrected, and we do make sure that follow-up inspections are conducted afterwards. Because the issue of health and safety is very important in nowadays. All the outlets must have sanitizers, which are recommended by the Ministry of Health together with WHO. The basic principle is the content of alcohol. But what happens is, most of these businesses are not complying to that. They are still using their homemade concoctions, which then pose a threat to the public.
The Shiselweni Police Regional Commissioner Tibonisile Mdziniso thanked Shiselweni residents for their continued display of obedience of the law, particularly towards fighting the pandemic.
We thank the public, we thank the leaders of the communities that they are with us in the control of the spread, because we communicate with them, coordinate with them, they give us support throughout. Thank you very much in that.
Mdziniso says a big challenge that the task team has identified is people not wearing their masks at all or wearing them incorrectly when they are walking by themselves. She then emphasized that people should wear their masks at all times to eliminate even the slightest possible chance of the spread of the coronavirus. Reporting for Eswatini TV News, I'm Sifiso Ngumalo with Muva Shongwe in Nhlangano.
In an effort to support government's initiative of taking care of the elderly people in the country, Mbuluzi Mbabane Rotary Club has donated food parcels estimated at 45,000 emalangeni to the elderly people in 3 chiefdoms. Presenting the donation on behalf of the organization was the member of Mbuluzi Mbabane Rotary Club, Marjorie Ballerine at Mbuluzi.
The outbreak of COVID-19 pandemic in March last year has negatively affected many sectors in society. Events such as Sibebe Survivor Challenge, which was usually held in August in the country, was not organized due to restrictions imposed by government in order to bring the spread of the pandemic under control. To continue with its mandate of taking care of the elderly people in the country, Mbuluzi Mbabane Rotary Club has donated food parcels to the elderly from 3 chiefdoms, which are Mahebedla, Langeni and Chibugwene. The aim of distributing the food parcels, which includes bags of rice, bags of mealie meal, tinned fish and beans to the elderly, is to support the government's initiative of taking care of the elderly in the country during the trying times of the pandemic. Mbuluzi Mbabane Rotary Club member Marjorie Ballerine says more than 90 elderly received their food parcels.
But we thought we might as well just help a little bit again, so that our people get the food, the assistance that they can in a small measure, because we listen to what government says, the DPM, and we listen to what Magelizi talks about, the people that are impacted by this COVID-19. So we can't really have all the money, but wherever the little place, they say, find someone. And if you help that one person will go and help another person. So we are just moving it forward by that. Rotarians helping here, and that person, someone will come to their home and say, we don't have any food. They'll say, come, let's eat together. And that's playing it forward.
Ballerine then conveyed her appreciation to Super Spa, Pick and Pay, Sibebe Resort, Inner Wheel International, Eswatini Trading and Brian Marsh for the sponsorship of 45,000 emalangeni. For Eswatini TV News, Zoto Andlamini with Mbonga Dube, Mbuluzi.
ACAT organization visited Njabulweni community to assess the extent of damage caused by dongas. We have a report.
ACAT is an organization that aims to improve rural communities. ACAT says they have visited 4 constituencies in the Lubombo region to look at the damage caused by dongas and soil degradation in those areas. When talking to Bongani Slongonyane, an assistant coordinator at ECHET, during their visit at Njabulweni community, he says dongas have caused a lot infrastructural damage.
Because singibola bathenga lesito kakhulu sibuka letindvonga lesibona ukuthi litawuba affect esikhathini lesiningi uyithola ukuthi siyafuna nalokwadi nalamakhaya la around ukuthi if ever ledonga lelisithi sifuna kusita kibo litawusita abantu labangakanani kuze bakhona ukuthi basitakale.
Njabulweni community headman Nhlanhla Zubuko says dongas have made it impossible to move, as there are places that cannot be accessed using cars.
Indvonga leti lesinato la mangweni disilimata kakhulu kunetindlu etiningi lesingasakhona ukudenda usho tinkomo nekuletinye indzawo tsahambi netimoto letinye indzawo tsahambi noma ngakufiwe khanza kuthwala umuntu ngelibhokisi umthwale ngetandla noma ngakuhamba imoto awetele ngesheya na utibona letindvonga ngandla letingito zitawunyekula emakhaya.
Zubuko said they hope that ECHET, together with the government, will help them to address the donga situation. Reporting for Eswatini TV News is Tembelihle Makuchwa with Temba Shabangu at Njabulweni.
Women and girls in science play a critical role in the fight against COVID-19. This was revealed by Nelson Ndwandwe, who is the Science Program Officer at UNESCO, during an interview with Eswatini TV in Babane.
The International Day for Women and Girls in Science is celebrated worldwide, and this year's theme addresses women scientists at the forefront of the fight against COVID-19. United Nations Educational, Scientific and Cultural Organization, a science program officer in the country, Nelsiwe Ndwandwe, says women scientists plays a significant role in the fight against COVID-19.
The COVID-19 pandemic also had significant negative impact on women scientists, particularly affecting those at the early stages of their career, and thus contributing to widening the existing gender gap in science and revealing the gender disparities in the scientific system, which need to be addressed by new policies, initiatives, and mechanisms to support women and girls in science.
Head of Chemistry at the University of Eswatini, Dr. Tabile Ndlovu, has advised women and girls to be involved in science studies in order to bring solutions in the country and in the world in terms of research.
As women in science, we are also trying our best to do or to contribute to science in the world. Of course, we've got challenges here and there. This year we have seen that there's the issue of COVID-19, which requires scientists all over the world to try and do research in a very short space of time to try and solve or to get the world out of this pandemic.
Dr. Ndlovu further says science and gender equality are both vital for the achievement of the internationally agreed development goals. For Eswatini TV News, Zodwa Dlamini with Mbonga Dube, Babane.
The chairperson of the Hotels Association, Mark Ward, says it's a concern that there is little response from the public on Valentine's specials advertised by the hospitality sector, as they had hoped the situation would be short-lived. He says, be that as it may, they understand the impact of the pandemic.
The Hotels Association chairperson, Mark Ward, says the hospitality industry had recovered for a while after a government relaxed the partial lockdown, and they saw an increase of people visiting and making bookings of weddings and other celebrations. Ward says during that time they were able to make profits and pay their staff a certain percentage of their wages. He says by means of reviving the situation, when the month of February commenced, the hospitality industry put out adverts on social media on specials they are running for Valentine's Day, which are not receiving the anticipated response.
I do see a lot of the industry has responded, and I see there's a lot of adverts out, and I do hope that the people take their time to spend time together and make it a special occasion to recommit to each other and renew their relationships, as it were, because we've been through extremely stressful time with this pandemic. So I think a lot of the establishments in Eswatini have come out and put adverts out there for special couples time. And as far as I can see from Mountain's bookings and what I can see in the marketplace, there's not much response to it, and that's really understood with the regulations and the laws that the government have put in place at the present moment.
Ward says the state of the hotels is worsening and pleads government to look into it and come to their rescue. Reporting, I'm Lungelele Makakula in Bawane.
A very good evening once again. You're still watching Eswatini TV. Now we'll have a look at our sports news. The Eswatini Royal Police Service has sent a stern warning to those who continue to defy COVID-19 regulations by engaging in different sporting activities despite the ban imposed by the government on all sports.
Even though government stopped all forms of gatherings, including all sporting activities, while the country is fighting the spread of the coronavirus, there are those who still seems to be defying all the regulations put in place, as some are occasionally found playing different sports. Eswatini Royal Police Deputy Police Information and Communication Officer Nosipho Mngoni says they will continue arresting all those who are still breaking the regulations.
We as the Royal Eswatini Police Service, we would like to assure the nation that we have witnessed that some people continue defying the order that was brought out by government, that of people not gathering for whatever reason, such as playing sports or having fun. We promise the nation that we will not deter. We will continue being out there and ensuring that the regulations, the COVID-19 regulations, are kept as to the word. We have noticed that some people continue to defy these regulations, but because we want to ensure that the nation is safe from the coronavirus, we will not rest until every other person knows how serious this situation is. Thus, we will continue taking them to task in order for them to face justice, because they are indeed breaking the law.
Reporting for Eswatini TV Sports News, I am Patizum CV Mbabane.
That's all for now. Before we conclude, let's have a look at tonight's headlines. The shortage of medication for people living with epilepsy worries His Royal Highness Prince Banzile. Government, in collaboration with the International Organization for Migration, has launched the Diaspora Engagement Initiative. Clinics for ex-miners which were temporarily closed will resume operations before the end of next month. And with that, we sum up our bulletin for the evening. Up next is the weather update. From myself and the team here at Eswatini TV, thank you for watching. Good night.